Yes, Ms. Burton.
Good morning, sir. This week, the inquiry will hear from a group of clinicians about blood transfusion policy and practice. The purpose of this presentation this morning is to set out the experiences of transfused individuals and their family members. Examples in this presentation are taken from Northern Ireland, Scotland, Wales and England from the late 1950s onwards. This presentation does not seek to be exhaustive, and it does not examine the individual details and the experiences of infected individuals and their families after diagnosis. What it does seek to do is focus on the medical procedures where transfusions were given, the consenting process for those transfusions, information or sometimes a lack of information given to patients about the risks of blood-borne infection with transfusions, and considers issues of communication of diagnoses. So there are 5 key themes when reading the witness statements received by the inquiry in relation to individuals who have received transfusions. The first theme is that there are a number of individuals who were unaware that they had even received a transfusion at the time of their surgery. In some circumstances, this is because transfusions were given on an emergency basis, often individuals were unconscious. But in other circumstances, transfusions were given as part of elective or exploratory procedures. Now, some witnesses express a concern that there might be individuals out there who are infected and still don't know about it. The second key theme is about the lack of information given to patients and their families before and after transfusions were given. Almost all witnesses state that they were not informed of any risks of blood-borne infections involved in receiving a transfusion. The third theme is that there is a wide gap, often measurable in decades, between the date of the transfusion and the date that an individual was informed of their infected status. The fourth theme, and this is a significant one, sir, is the lack of documentary evidence that exists to say whether a transfusion was given or not given. Many witnesses describe difficulties obtaining their medical records or the medical records of their loved ones. This is most often in the context of applying for trusts and schemes. In many cases, but particularly in cases involving maternity care, those hospitals have long since closed and many of the records have been destroyed. And for a large cohort of patients, receiving a transfusion was part of a one-off interaction with the NHS, and therefore they don't have a known clinician that they can approach for information about their treatment. Where medical records do exist, there are often scenarios where fundamental or important details are missing from those records, such as the batch numbers of blood that was received. And during the presentation today, we're going to bring up some examples of contemporaneous medical records, and particularly consent forms, to see if we can show some light in relation to the relevant practices of the time. The fifth theme, sir, that arises from a review of the witness statements received by the inquiry is that there's a large cohort of patients who had frequent interactions with the NHS. This is normally due to long-term health conditions. In particular, individuals with sickle cell anemia, thalassemia, and leukemia fall into this group. Now, these people had frequent medical interventions, often over the course of their lives, and often at a range of hospitals and treated by lots of different clinicians. Many in this cohort question why, in those circumstances, their infections with blood-borne viruses were not identified earlier, or they were not communicated earlier to them and their families. Before we look at those themes in more detail, sir, we're going to look at some of the medical scenarios where transfusions were given. The first relates to maternity. The inquiry has received a significant number of statements that relate to pregnancy, miscarriage, ectopic pregnancy, labour, and postpartum hemorrhage. But also the inquiry has received a number of statements that relate to problems nothing to do with having children, so hysterectomies and gynecological procedures. And we're going to look at some documents now in relation to this category. So the first example, sir, is a hospital worker, and she was infected with hepatitis C as a result of a transfusion in St Helier Hospital. If we could turn up WITN 0294002, please, Sally. What we see here, sir, is an inpatient treatment summary. You can see that at the top of the page. And if we go along to the right, there's a date admitted under the word speciality. That's the 11th of September 1975. Now, you might look at the date of discharge and think, is that a 1979? But a consideration of the rest of this document and the witness statement is that this relates to care in 1975. We can see underneath the box diagnosis, this is a case of ectopic pregnancy. And if we scroll down, Sally, please, to the bottom of the page, there's a heading that says operation. And we can see post-operative course. Just above that, it says that there were 650 units of blood found in the abdominal cavity. And the post-operative course was a transfusion of 3 units of blood. You can take that down, thank you. Another example in this category is a woman who received a blood transfusion as part of an emergency caesarean section in 1984 at the Harrogate General Hospital.
Just for one moment, translating 650 mils, which had obviously been lost in the blood cavity, how does that relate in volume to 3 units of blood?
So I can't assist with the direct correlation of the maths. It's something that we can look at for you.
And on the face of it, 3 units of blood would be rather more.
It would.
Quite a bit more.
Yes. That is a theme that we're going to come on to look at, which is the issue of necessity and volume of treatment. That example is just to look at an early example of an operation note.
Yes. Thank you.
So the second example is that of a woman who, as I said, underwent a C-section in 1984 at the Harrogate General Hospital, and she was diagnosed with hepatitis C in 2003. That hospital has closed down, but she has been able to find limited contemporaneous records of her transfusion. Sally, if we can go to WITN 3693 002, please. We're going to look at 3 documents. You just scroll down, please. Thank you. So we can see here on the left-hand column, there's a big box at the bottom which says supply of 2 units of whole blood, and we can see that the treating clinician here has crossed out the other 2 and has left a supply of 2 units of whole blood. And then on the right-hand side of this document, we've got that the blood is O positive and those serial numbers. So this is an example, sir, of somebody that has been able to track down the key information, i.e. how much blood she received and what those specific serial numbers were.
Just as a matter of observation, the cover sheet, I don't want you to go back to it, the cover sheet has the surname, and the surname is redacted on this sheet here. So can that please be checked by the redactions team?
Yes, thank you, sir.
And if I'm right, then either apply a redaction or remove the cover sheet.
So I don't think that's an anonymous witness. I think it's just on this form, it's because that's her address and it's just gone over her surname.
Thank you.
So can we go to the next document, please, which is 003, Sally? Yes, it's WITN 3693003. Okay, we won't go to that, but what it is there, I'll just describe it. It's a register of units of blood And it's an undated document, but it's a document that's found in her medical records. And on that document, it lists the same blood numbers that we've seen in this document. So she's been able to piece those two documents together. Sally, can we go with the same witness, please? WITN 3693006, please. What we see here, sir, is the consent form from the 1984 procedure. And you can see in the middle of the page where it says, I also consent, that the language of this consent form is, I also consent to such further or alternative operative measures as may be found necessary during the course of the above-mentioned operation, and to the administration of general, local or other anaesthetic for any of these purposes. So pausing there, sir, we can see that on the face of this 1984 consent form, there's no express reference to a transfusion or any blood or the risks of any blood on the face of this form. Now, this we say is important because it fits with the witness evidence that the inquiries received that lots of individuals were simply unaware that they had in fact had transfusions. Doesn't appear to be on the standard wording addressed with patients pre-operatively. Another example, please, is WITN 0891002. Now, this is another example of an a consent form. This relates to a nurse who underwent a caesarean section in 1995 and was diagnosed with hepatitis C in 2018. So this is a consent form from a decade and a bit later than the one we've just looked at. And Sally, if you just scroll down so we can read what it says, we can see a very similar or almost identical wording that we've just looked at in the 1984 version. So from 1984 to 1995, it suggests that, again, there's no express reference to an individual receiving blood or it being formally on the face of a consenting document. Now, this individual who underwent this caesarean section, her husband has also supplied a witness statement to the inquiry, and we're going to look at some details in it. WITN 0840001. This is an anonymous witness, as we can see, but if we look at paragraph 2 of his statement, he says that he's here to speak about his wife's infection with hepatitis C, and it's relevant for our understanding of this witness statement that this man was also a nurse, so some medical experience here. If we turn to paragraph 10, please, which is on page 3, he describes, from his point of view, what happened in relation to his wife's caesarean. So he says, very shortly after the C-section was completed, my wife was given multiple blood transfusions because she was hemorrhaging. My wife began receiving transfusions on the night of the procedure and continued to do so for 2 days. I was not informed or consulted about these blood transfusions, and the only evidence that consent was given is a form apparently signed by my wife at the time when she was under high stress and in extreme pain and discomfort. So that's obviously the form that we've just looked at. In relation to issues of consent, at paragraph 15, he says this: prior to her transfusions, no information or advice was ever provided to either my wife or myself regarding the risk of being exposed to any infection. Then in relation to the issue of necessity, he says this at paragraph 16. I accept that receiving at least one blood transfusion would have been vital for my wife, given the amount of blood she was hemorrhaging. yet I remain unconvinced that all 6 of them were strictly necessary. Now, sir, picking up the theme of necessity, which you've touched on in your questions to me, a lot of the witness statements query whether transfusions in and of themselves were medically required, but also whether the quantity of blood was required. And particularly in relation to maternity issues, lots of the statements refer to doctors speaking to women about topping up their blood levels or aiding their recovery after giving birth. 2 examples. The first is a statement from a woman who underwent a forceps delivery in 1985 when she was 16 years old. She was diagnosed with hepatitis in 2000. Her statement, please, WITN 1910001. And if we can turn the following page, please. We can see paragraph 6. She describes the location of the transfusion at the Dryburn Hospital in Durham, which has subsequently changed its name. And in paragraph 7, she sets out the issues in relation to the transfusion. So it's recorded in her medical records that her hemoglobin levels were 9.1, and she was transfused with 2 units of blood. 1, as we can see in paragraph 7, on that day. And then if we look at paragraph 8, please, the following day she had a 2nd unit of blood in the evening. Paragraph 9 refers to this issue of the possible necessity for these transfusions. I can remember sitting on the bed after giving birth and I felt really dizzy. I did not have any other symptoms. I do not think I was actually bleeding. I just felt dizzy. At no time, either before or after the transfusion, was any information or advice provided to me or my parents about the risks of being exposed to infection. Now, one final example from this category. We could be here for weeks in relation to the evidence about maternity issues, but one final example, WITN 3286001. Now, this is a statement from a widower, and his wife underwent a hysterectomy in 1994. Could we turn the following page, please, Sally, to paragraph 3? So paragraph 3 discusses that the operation was a hysterectomy on the 9th of August 1994 at St Margaret's Hospital, and this is confirmed in the medical records, that Maureen was transfused with 2 units of blood during the surgery. Paragraph 4, please. So this is an example, sir, of individuals that have been able to track down the specific batch numbers, and we can see them there. Paragraph 10, please. This is the husband's description of what happened post-operatively. Initially, all appeared well after the hysterectomy operation and associated blood transfusion. Maureen seemed to be coping well. However, from the 15th of September 1994, Maureen had become noticeably jaundiced. She also suffered with nausea, vomiting, and had diarrhoea. Maureen's urine was also looking very dark, and then there's a reference to a medical record confirming that. Can we go to paragraph 21, please? In relation to consent, her husband says this: Maureen and I were only made aware of the blood transfusion after Maureen's surgery, when we asked whether the operation went well. It was at this point that the doctors told us that Maureen was given a blood transfusion, I think that should say, and that Maureen could have possibly managed without having the blood transfusion, but would have taken a little longer to recover. So the presentation note deals with a wide range of medical conditions where transfusions were administered. And I'm just going to touch on some of those in this oral presentation. The first aspect relates to stomach and spleen conditions, and there's a whole host of conditions in this category, things like Crohn's disease, colitis, appendicitis, peptic ulcers are all examples where transfusions were given. Often these were emergency scenarios, and we're going to take one example. This is an example of an affected son who describes that his father received a blood transfusion in 1980 or 1981. We don't need to bring this statement up, but just for the transcripts, it's WITN 05T5001, the statement of Gary McKelvey. Now, his father developed a stomach ulcer which ruptured. He felt very dizzy and fell over, and he was admitted to the White Abbey Hospital in County Antrim for emergency surgery, and in those circumstances he received a blood transfusion. So that was 1980, 1981. In 1990, about a decade later, he had a very low platelet count and received a transfusion at the Belfast City Hospital. He was diagnosed shortly after that procedure with hepatitis C in March 1991. And the registrar that was treating him told the family that it was the first transfusion that was likely to have been responsible for the hepatitis C. His father sadly died shortly afterwards in June 1991 with hepatic failure and viral hepatitis listed 1A, 1B on the death certificate. Now, despite repeated and sustained efforts by this family, they've been unable to access any of the medical records and therefore cannot prove that the transfusion took place in 1980 or 1981. Kidney and liver conditions are another significant area of the witness statements that the inquiry has received. I'm going to just highlight two examples in relation to kidney treatment. The first is that of Dorothy Anderson. No need to bring up this statement, but for the transcript, WITN 2074001. In June 1979, she was admitted to the Stirling Royal Infirmary in Scotland in relation to the removal of a kidney stone. This was an elective, not emergency procedure. Pre-operatively, she had blood taken and was due to undergo surgery the following day. However, she was then told from an examination of her blood that her haemoglobin levels were too low and she was not fit enough to be anaesthetised. So what happened then is that she was given a blood transfusion pre-operatively in order to increase her haemoglobin levels. She recalls being given 2 bags of blood. She says that the risks of infection were never explained to her, and she says this: "I had absolutely no reason to think that there should be any problems. I did not think about it for years." Her husband has also provided a statement to the inquiry, and we're going to look at WITN 3097001, please. And so just pausing there, the reason that I'm often going to husband statements when it's the women that are being treated is often that they were involved or awake for some of these decisions in relation to consenting processes. So I'm not seeking to remove the voices of anyone infected, but it's often the affected members in these circumstances that have detailed evidence to give in relation to consent. So if we look at paragraph 4 of this witness statement, please. Her husband says this: No doctor spoke about the risk that Dorothy faced by receiving a blood transfusion to either her or I. She was not given the choice, despite the fact it was not life-threatening. It was a case of this is going to happen, and that's the way it was. Now, so that expression of that's the way it was features in a lot of the statements received by the inquiry. It is as though the transfusion would have happened in any event, regardless of any patient view on it.
I mean, one of the things that we had emphasised to us by the medical ethicists was that part of the process should involve respect for autonomy, should involve giving a patient choice. At this time, 1979, do you happen to know whether supplementary iron was a treatment readily available or not?
I don't, sir, off the top of my head, I'm afraid.
Because I suspect, though I don't know, that later on, rather than give blood, a form of giving iron to increase the ability of the blood to carry oxygen, produce hemoglobin, would have been the preferred option.
That may well be right, sir, and this week obviously we're hearing from a range of clinicians, and those are the sorts of questions that can be put to those individuals.
I'm raising it knowing that that's the case, and perhaps that can be raised in due course with one or other of those who give evidence.
Thank you, sir. So we've just looked at paragraph 4 in relation to the information or lack of information that was given to this couple pre-operatively. The rest of this story is that in about 2002, 2003, Dorothy went to her GP because she was feeling constantly tired. Her doctor took her for blood tests, and she states that she received a letter from her GP with a single line saying that she had hepatitis C. The letter did not include any invitation to come and discuss the results or discuss the condition with her. And she describes this as a terrible way in finding out you've got an infection. She has managed to obtain some of her medical records. However, records for this specific transfusion are missing. Both Dorothy and her husband query why she wasn't tested or notified prior to 2003 or 2002. And this is a theme, sir, that we'll come back to in this presentation, the period of delay between transfusion and communication of diagnosis. The second example is rather striking in relation to kidney treatment. It was a woman who was suffering from renal failure, and in May 1984, she was put on the transplant list. In September of the same year, 1984, a matching kidney was found, and her husband rushed to a hospital in Manchester for the kidney. Just look at the detail of this. It's WITN 2781002. So this is a rather lengthy letter, which I hope you'll bear with me while I read aloud, because it summarises the quite striking facts of this example. We can see at the top of the page, it's written to some solicitors in September 1992, so some years after the events. And Sally, if we can just scroll down, starting with that second substantive paragraph. The woman was admitted under my care as a matter of urgency. So for completeness, I should say that this is written by a consultant surgeon who was treating the woman. Admitted under my care as a matter of urgency on the 20th of September 1984 for a cadaver renal transplant. She had been in chronic renal failure for approximately 13 years. Her primary disease was pyelonephritis complicated by hypertension. She had been treated on dialysis for 3 months prior to admission. She received the right kidney from, I'm just going to call him a man, aged 23 years, who had died as the result of a road traffic accident and a head injury on the 19th of September 1984. Prior to the removal of the kidney, The man was tested for hepatitis, HIV, cytomegalovirus, and found to be negative for all three. The transplant took place on the 20th of September, and the match was almost perfect, with only one measured mismatch at A3 on the HLA locus. The woman was also tested for hepatitis, cytomegalovirus, and HIV, and she was negative. Post-operatively, her transplant functioned extremely well. She had 2 episodes of acute rejection, both of which responded to treatment with steroids, and her progress was complicated by a viral infection of herpes simplex. Subsequently, she made excellent progress and was discharged from hospital and followed up in the transplant clinic. There's a reference to her treating clinician. Approximately 2 years later, while still under the care of that treating clinician, she developed an unspecified illness with enlargement of the lymph glands in her neck and tested positive for HIV. The exact details he refers to the treating clinician. Bottom of the page, please, Sally. Suffice it to say that when we went back to look at the donor to see whether or not that was the source of the infection, it transpired that one of the units of blood given to the man during the course of his resuscitation had subsequently been shown to come from an HIV-positive donor. This was 1 unit of blood and a transfusion of 15 units of blood, necessitated by his injuries caused in the road traffic accident. We then reviewed other recipients of the man's organs and found that the recipient of the other kidney, one of our patients, had also converted to HIV positivity, and the recipients of his liver and heart, respectively, had also converted to positivity. In conclusion, there is absolutely no doubt that the woman's HIV infection was transmitted via her kidney transplant from the donor, and that the origin of the infection was from a positive blood transfusion given to him in resuscitation. During the course of her HIV illness, she was under the care of Dr. Ackrill, and the letter states that further details can be found. This woman sadly died from AIDS in 1987, aged just 33 years old.
We don't presumably know what happened to the other 3 who were infected as a result of transplants from this individual. What the doctor doesn't say is that the blood, in the donation of blood was tested.
Doesn't say that, no, sir.
Whereas he makes a specific point of saying that if both the young man who died and the recipient were.
Yes, sir.
Yes. So the test was done too far down the line.
Absolutely. Now, so there's a lot of evidence received by the inquiry in relation to orthopaedic and also traumatic injuries. A large number of statements we have received relate to examples of polytrauma, for example, in the context of a road traffic accident. There are also examples of physical acts of violence, so stabbings, attacks, football hooliganism. But also at the other end of the spectrum, there are examples of routine orthopaedic treatments, hip replacements, knee replacements, as well as genetic or inherited conditions. And I'm just going to give you one example from this category. There are many more set out in the written presentation. Example of a man who was involved in a road traffic accident in Scotland in 1971, and he was diagnosed with hepatitis C in 2018. We have a copy of the operation note, and can we go to WITN 0831002, please? On the first page, we can see there's a heading in theatre. There we go. And this is a example of the treatment that was received. So there's a reference to local anaesthetic, skin grafting. But if we go down the page, please. to the next page. We can see at the top of the page, this is the road traffic accident, and issues of glass and lacerations of the face. And we can see in the middle of the page the surgeon there explaining the treatment that was given. But over the page, please, further, Sully. There's a description of the blood that was given. So it says, prior to admission, blood loss had been severe. Blood pressure on admission about 60. For this reason, given plasma on admission, followed by 2 pints of blood overnight, and in theatre required a further 2 pints. And there's reference to injuries and also an undisplaced physiofracture of the neck of scapula. So that's just an example of blood being given, what looks like on arrival, and also perioperatively, so during the procedure. The next collection of conditions, if I can call them that, relate to paediatric conditions and the experiences of children and their parents. And we have lots of examples of individuals who are now adults describing the treatment that they received as children, but also their parents looking back and describing their experiences of blood transfusions. A significant number of these statements relate to leukemia. And as you are aware, the treatment for leukemia obviously involves multiple blood transfusions and sometimes bone marrow transplants. One example in this category, WITN 0267001 for the transcript. We don't have to go to it, Sully. But this is a child who was diagnosed with acute lymphoblastic leukemia as a child. And his family can recall the precise day of the diagnosis with leukemia because it was the day after the Pope visited Manchester. So he was only 3 years old, but it's gone down in family history for those reasons. Now, between June 1982 and 1984, he received treatment for his leukemia at a hospital in Manchester. And it was as part of that treatment that he received a blood transfusion. 1984, he received the all clear from his leukemia treatment. He was then sadly diagnosed with HIV in 1994 when he was just 15 years old. Now that diagnosis came 2 years after a period of declining health, weight loss, and a lack of growth. We're going to look at a statement by a family member. This is an anonymous witness, so we'll look at a family member statement, WITN 0872001, please. And if we can turn up to paragraph 25, please, Sully. While that document's coming up, sir, just to fill in the factual picture, this family received a lump sum payment in the mid-1990s from the Department of Health that was paid into court. But the section that I want to look at relates to the experiences of a family member when they were told about their loved one's diagnosis with HIV. If we can't get there, I'll just read it out. But for the transcript, it's paragraph 25 to 27. And the family member says this: I remember being at the hospital when they summoned me into a separate room. I do not remember the specific words they said. It was a shock to find out that he had HIV. An explanation was given to me about a treatment process. The first drug was to be one that started with a Z. I felt numb. My emotions were high. I had such disbelief about the whole situation. It was tough news to take. I remember Dr. Wilkins spoke about how people were currently surviving about 3 years, but they were making great medical progress in finding new ways to treat HIV. News that new drugs were being tested with progress being made was somewhat of a relief. I recall thinking that he may live longer than 3 years. I've always tried to look for the positive, and this news gave me some solace. Prior to the test results, I did have thoughts wondering how the infection could have happened. I queried this with the doctors. They said in this case it could have been through a blood transfusion. The only time he had a blood transfusion was during his leukemia treatment. Now, considering the facts of this example, sir, one could query why this family didn't receive an HIV diagnosis until 1994, following a transfusion in the period of 1982 to 1984. Another example in relation to leukemia is the account given by a woman who contracted hepatitis C as part of her leukemia treatment. WITN 019001, please. So I think we're having some technical difficulties. May we have 5 minutes just to have a look at the system?
Yes, that number is wrong. You're missing 2 digits, I think, or 1 digit.
That might well be right, sir, but I think the whole system is not working.
Right. Well, let's take a short break, shall we?
Thank you.
What do you suggest? 5 minutes? Does that be long enough, Sonny?
That sounds perfect. Thank you.
5 minutes.